So there are 5 things I think you should think about if you're trying to maintain good cardiac health. The first thing is, if you are a smoker, it's really important that you do everything you can to stop smoking. We know that if you stop smoking, 12 weeks afterwards, your cardiovascular and circulatory health has already improved. And 1 year afterwards, your risk of having a heart attack is half that of people who are still smoking. You can use things like nicotine replacement therapy and support groups to help you with that. And vaping or e-cigarettes can be used to help you stop smoking, but they're only useful if you're reducing the nicotine sequentially with the intention to stop entirely. E-cigarettes and vaping are not without risk on their own, and so really should only be used as a tool to help you stop smoking and to come off of all nicotine products entirely. Now, not everyone smokes, and there are other things that you can do to improve your cardiac risk. So the second thing to think about is eating well and maintaining a healthy weight. If you have a BMI over 30 or a waist circumference over 80 centimetres for a woman or 94 centimetres for a man, that means you're at higher risk of developing heart disease because you're storing fat around your internal organs. So losing between 5 and 10% of your body weight can reduce that risk, and you can do that in a number of ways. But there is a great diet that you can use that is known to not just help you reduce body fat, but is also known to help cardiac health. That's the Mediterranean diet. The Mediterranean diet consists of healthy fats and oils, things like avocados, olive oil, nuts, healthy proteins such as fish and chicken, plenty of fruit and veg, and most importantly, hardly any processed food. So if you're going to do anything for your diet, think about introducing a Mediterranean diet. Another thing to think about when we're talking about diet is actually alcohol intake. Lots of people don't think about this when they think about diet, but what we drink goes into our stomach just like what we eat. And drinking any alcohol can be risky, but certainly drinking over 14 units a week will increase your risk of heart disease. And there's a common misconception that red wine is good for your heart, but I'm sorry to tell you that's not the case. So 14 units a week, about a bottle and a half of wine or 6 pints of lager or beer a week is your upper limit to keep your heart healthy. The third thing to think about is to really understand your personal risk. And that's made up of things like your genetics, your family history, your gender, and then modifiable risks, so how active you are, what kind of diet you have, and whether you're a smoker. Knowing your risk can help you manage your risk. Which brings me on to the fourth point when we talk about managing your risk. Know your health. If you have high blood pressure or high cholesterol, if you've got diabetes, then the best thing you can do to reduce your risk of heart problems is to manage those conditions well. And we know the more you know about a condition, the more you understand how it affects you, the better control you can have of that. So speaking to your healthcare professional, looking up trusted places for advice like bupa.co.uk, you can find really useful information on how to manage those conditions. And the fifth and last thing, and probably the most important, is staying active. We know that the more active you are, the better it is for your heart. We know that sitting down for long periods of time is not good for the heart, so it's really important to try and introduce activity if you do have a sedentary lifestyle and carry on increasing that as much as you can. So you can walk every day, that would be amazing. Walk further, walk longer. You don't have to be doing particularly strenuous activities to get benefits from being active. But we know the more active you are, the better it is for your health. So whether you've had a heart problem, whether you've got family history of heart problems, whether you are a smoker and you're just planning to stop, whatever you're doing, try and stay as active as possible. That's one of the best ways you can maintain good heart health. I hope you found some of that information helpful, relevant for you, and you took away 1 or 2 things that you could do or try to help maintain a healthy heart.